Welcome back at 6:41 now. May is Skin Cancer Awareness Month, and today's been designated Melanoma Monday to bring attention to a very common form of skin cancer. And joining us in studio this morning is Dr. George Verghese. He's a board-certified dermatologist whose office is offering free screenings all throughout this month. And thank you, doctor, for being here.
No problem. Good morning.
Good morning. We got that rain pounding down out there, this morning, but Tony is promising the sun's going to come out a little bit later on today. For those sun lovers out there, how much sun is too much sun?
Well, basically, we have to avoid the time between about 10 and like 2 p.m. where the sun is most intense. But, 15, 20 minutes is not a bad thing. But we have to remember, use at least a 30 SPF because Academy now recommends about 30. Make sure it says UVA and UVB because both kinds of ultraviolet radiation come to the Earth's surface. You know what? Every day we hear, we sort of hear conflicting things, stay out of the sun, but you need the sun because the sun provides all the vitamins, so many of the vitamins that we need to stay healthy. Exactly. So what are you supposed to believe? How much time should you spend in the sun? 5 to 10 minutes is not a bad thing. But remember to use your sunscreen, like I just said. And the way to get your vitamin D, the American Academy of Dermatology recommends, is through supplements.
Okay.
So depending on your age, it's either 600 to 1,000 milligrams a day. So that's the best way to get your vitamin D nowadays.
We were just saying that being outdoors is great for your mood. Helps in depression, helps you just, be overall happier. Those of us that have a little bit of a darker skin, are we a little less susceptible to skin cancers than those who are fair-skinned?
Absolutely. We have about an SPF about 4, so a little bit of natural protection. That doesn't mean
automatically in our skin?
Automatically. But that doesn't mean we, take skin cancer for granted. We still have to use sunscreen. We still have to do self-skin checks. We still need to visit our dermatologist. So we don't get a free pass, unfortunately.
So what types of things should we be looking for if we are, in fact, sun lovers and, a little bit concerned about skin cancer?
Well, to make it easy, there's an A, B, C, D, E.
Okay.
For people, everyone has a lot of moles. What you're looking for is asymmetry. One side larger or bigger than another.
Of moles?
Absolutely, okay. Moles. B for border, an irregular border. C for color, different colors, blue, green, black, red, different colors. D for diameter, 6 millimeters or greater, like a pencil tip eraser size. Okay. And the most important, E for evolution or change, something that's changing over time.
So is that, if you are spending a lot of time out in the sun, is that a mole the only indicator that you are in some sort of danger? Or are there other things to kind of watch out for?
Absolutely. There are other things as well. Yeah, scabbing, bleeding, things are red, scaly, that are just there for a couple months, not going away. That kind of tips you off, hey, I need to go see a professional.
Okay. And that sort of shows you, that picture shows you, exactly. The difference between what you need to be looking out for. How many different types of skin cancers are there?
There are 3 main kinds. The most common being basal cell, which is 80%, squamous cell is about 10%, and melanoma, which is about 4% or so. The most deadly being melanoma, about 100,000 per year, 40,000 invasive, and 8,000 people die. But
wow.
I know, we just don't, realize that.
Right.
But the important thing is it can be prevented with early detection, and including sunscreen, self-skin checks. I brought a little mirror so people don't forget. Head to toe. Don't forget, and behind your ears, your toes. Okay. A loved one can help you with your back. Okay. But we only see you maybe once a year, but you see yourself in the mirror every day. So it's important once a month to do a full body check. Just look for any kind of changes that you might see. Exactly.
If you do spot something, what kinds of treatments are there?
Well, it depends on what exactly it is. When you see a professional, he may be just a pre-skin cancer, so very easily treat. But if it's a skin cancer, a biopsy may be needed, an excision, Mohs micrographic surgery if it's like a basal or squamous cell.
Wow. Okay. All right. And in terms of the sun blocks and sunscreens that you're talking about, exactly what do they do to protect your skin, and how often should you apply those if you're going to be out in the sun all day long?
Well, first thing is if for a full body, it's going to be about 2 ounces or more, and we have to reapply almost every 4 hours or so. Okay. But basically, the ingredients in there, some are going to block UVB, and some are going to block UVA. What we don't realize is the number, even if it's 100, is only blocking UVB, ultraviolet radiation. So make sure on the label it says UVA and UVB as well.
All right, very good. Great tips. Thank you so much, Doctor, for coming
problem.
by. We've put those tips on our website, myfoxdc.com. You can also find out how to get those free screenings, which are available through your office this month. As we mentioned a couple of minutes ago, Tony, we're hearing that rain coming down out there.